Hello, my name is Dr. Ernestine Wright. I am board certified in internal medicine and I'm also a geriatrician. I work here at Mercy Medical Center and I'm one of the primary care physicians. I would like to speak to you today about the importance of getting the COVID-19 vaccine. COVID-19 has been devastating. There are so many patients who have stayed away from the hospitals and who have not had their routine checks and who have stayed at home and really not paid a lot of attention to healthy eating. We're seeing a lot of evolution of diabetes and uncontrolled hypertension. So now more than ever, it is important that we try to control this pandemic so we can get back to the business of making sure that our patients stay healthy and that they don't fall victim to diseases that were otherwise very well controlled before the start of the pandemic. It is very important that you protect yourself by using a vaccine that we know is safe and that has been proven and tested, rather than leaving yourself vulnerable to the risk of getting COVID-19 without knowing what the long-term side effects are. So I would encourage everyone. There are lots of myths out there about the vaccine, but look around. Lots of health professionals have been vaccinated, and there's still work going around, including myself, coming to work every day trying to serve our patients. I think it's important that you get vaccinated now. The sooner we can do that together, we can work together to beat this virus. Being young does not necessarily equate to having no side effects from getting COVID-19. There are many long-term effects from COVID-19 that are currently evolving, like problems with memory loss and problems with wheezing and asthma that goes on for months after. So I tell them that it's important that you get vaccinated. And you have to remember that also you vaccinate yourself to protect older members of the family. You may get COVID-19 and you may survive, but your mother and father and perhaps your grandmother may not survive. So it's very important that everyone gets vaccinated. The sooner we can stop the spread of COVID-19, the sooner we can get back to the business of socializing, which is what young people want to do. When you get the COVID vaccine, your immune system starts to build up antibodies against what's been injected into the body. And so the side effects you get, like body aches, fevers, chills, they're really a sign that your immune system is working to build up antibodies against COVID-19. They are short-lived, they resolve completely, and it should not stop you from getting the vaccine. Even after you have had COVID-19, it's very important that you get vaccinated, perhaps even so, because having developed COVID-19 tells you that you have a vulnerability to the virus, and it's important to get vaccinated so that you don't get reinfected once your natural, unreliable immunity has faded away. Now more than ever, it is very important that everyone get vaccinated. If the COVID-19 doesn't have a vector, i.e. a human being, to replicate in, then the ability to produce more variants decreases rapidly. So in fact, now more than ever, it's important that everyone gets vaccinated so we can decrease the evolution of these variants. Well, I just want to thank you for listening. I thank you for all that you do every day to keep our patients safe. I encourage you to get vaccinated. Please, this is the one way in which you can keep yourself safe, and together we can and will combat COVID-19. Thank you for listening.